Hi, I'm Sharon French, and I met Dr. Youssef in 2002. My sister she still has colon cancer, stage 4, and she's in remission. And because of that, I get checked often just to get a screening. And while I was seeing him and having that done, I found out that I had irritable bowel syndrome. Irritable bowel syndrome for me, you go from one spectrum of constipated to diarrhea, and you have a lot of abdominal pain. You're not sure what it is. I kind of knew the symptoms as a nurse of irritable bowel syndrome, but until you get a biopsy and they go in and take a good look inside your colon, you really don't know what's going on. So I wanted to make sure, and in the back of my mind, that I didn't have cancer. I remember thinking, okay, I worked with Dr. Youssef, and here I am having a colonoscopy. But he just kind of made me calm down and realize that, hey, you need to have this done. That's one thing I appreciate about him as I worked with him, that he would get to the bottom of the issues that patients had and then get back with them. That's something that I appreciated as a patient and as a nurse. Dr. Youssef just kind of stuck out to me, how compassionate he is with his patients and even with the people that he worked with. The staff is very friendly. They make you feel comfortable. If you go into other offices, sometimes, they're just like, you just feel like a number, and they're just real cold and there's no smiles. And you just feel a difference when you come in. My treatment plan was trying to have more roughage, better diet, fruits and vegetables, and also medication to help kind of calm the spasms down. I only had it a few times last month and kept counting and seeing, and it was improving. The quality of life improved so much because I didn't have to worry about it anymore. I could do my job. I could, have fun with my kids, be with my family, my church family. So my quality of life was a lot better. Dr. Youssef will follow through. If you feel like you have another problem and you need to come in, I did. A few years later with my pancreas, he will figure out what's wrong. He will send you where you need to go, and he will take care of it and follow through. And it doesn't matter how many times you come back until you feel like the problem has been solved. I worked with other doctors before I came to be with him, probably 20 years. And I've seen lots of different styles of practice, the way they treat patients. And you can tell when someone really cares. And when they do follow up, you appreciate it so much. I would recommend Dr. Youssef in this clinic because I know how they work. I know how I feel when I'm here as a patient and how I felt when I was a nurse here. And I would recommend anyone to come to this. If you're having problems with any gastrointestinal, I would recommend them to come. Sometimes it's hard to know when you should come in to a gastroenterologist. But if you have problems with abdominal pain, you have problems with constipation, diarrhea, or you're just having pain that just won't go away, that's somewhere in your abdomen, it's always a good idea to come in, to find a gastroenterologist and come in for a visit.